Good morning, ladies and gentlemen. It's my honor to present a dragon study on behalf of dragon study group. And today, last year we present the outcome for treatment experienced cases week 48, and this year in Hong Kong. And this year we present the data for naive patient, and the results will compare the results at week 48 and week 96 about the efficacy and weight change. It's my disclosure. The background, study have shown the impact of a second generation integrase inhibitor for HIV for people living with HIV about effect of weight change. However, limited data available among treatment-naive population in Asia. So the aim of our study was to assess the effectiveness and weight change for those patients who initiate Bictegravir or Dovato. As a background, we know the higher prevalence of weight change in people living with HIV after initiation any kind of treatment. And for those with normal BMI, they will increase about 20% of them become from a normal BMI to overweight after 1 year for antiretroviral therapy. And for those with overweight, they will increase about 15%, become obesity after 1 year. And the effect of obesity, they will increase the risk of cardiovascular disease in the long term. And we know this study, advanced study, will present the 192 weeks outcome last year in open forum infectious disease. We know that the weight change, the impact was obvious, especially in women. The greatest weight gain was observed with DTG plus TF-containing regimen. Then great weight gain was noted among women and men. And we can find out the weight change from DTG plus TF FTC. The mean change was about 8.9 kilogram, followed by DTG plus the TDF FTC. It was 5.8 kilogram, and followed by efavirenz TDF FTC. It was 3.3 kilogram. And it's, this study was published 4 years ago. It's a pooling study, it's a meta-analysis. And this meta-analysis also shows us the increased weight change for those people living with HIV, the regimen containing TF and integrase inhibitor for treatment-naive patient. We can find out the outcome of TF-containing regimen. It was a great impact of weight change. It was about 4.25 kilogram, followed by Bictegravir, TDF, and AZT. And the other one, integrase inhibitor, the containing regimen, the mean weight change over time in patient taking Bictegravir, big containing regimen, it was 4.24 kilogram, followed by DTG and Bictegravir. And for those patients switch from TDF to TF, it's published in last 2 years ago in CID. The mean on top of weight change, we can find out total cholesterol and triglyceride. They also increase, follow as well. And it's our material and method. Our dragon study was a retrospective and multi-center observational cohort study. It was conducted in 11 HIV care centers from March 2019 to July 2012. is our inclusion criteria. We only include naive patients. We will exclude those patients without data and those follow-up all days within 24 weeks. Our primary endpoint was the proportion of participants who experienced weight change more than 10%. And we will use inverse probability of treatment weighting of propensity score to balance the difference between Bictegravir and Dovato. The secondary endpoint was the proportion of participants with HIV RNA less than 200 copies at week from 24 to 96. Totally, we include 1,186 patients, and we exclude some patients we explained earlier. Finally, in the group of Dovato, we include 406 patients, and the other group, Bictegravir, we include 681 patients. As baseline characteristic, we can find out the best, almost all variables are not well balanced, such as age. In the group of Dovato, age is much older, about 3 years. And CD4 count at baseline before initiation Bictegravir or Dovato, we can identify CD4 count is much lower in the group of Bictegravir, and the proportion of CD4 count less than 200 cells per deciliter is 43%, is much higher than the other group of Dovato. And also for those patients with higher viral load, higher than 100,000 or 500,000 copies, the proportion was more so higher in the group of Bictegravir. And also BMI is a little bit lower in the group of Bictegravir. We demonstrate the secondary endpoint effectiveness, that's the HIV less than 200 copies. Overall, for overall population, the proportion of HIV less than 200 copies, there was no difference between these two groups, Dovato and Bictegravir, extremely high, more than 95%. In subgroup analysis for those patients with CD4 count less than 200 cells per deciliter at baseline, we can also identify those the difference was not significant. And subpopulation with CD4 HIV and more than 500,000 copies per milliliter, and the difference was not significant from week 24 to week 96. And CD4 change from baseline to week 96, and we can identify the CD4 count less than 200 copies is green, color green. We can find out the proportion from 43% in the group of Bictegravir, and after 24 weeks, the proportion become not different significantly between these two regimens. And weight change is our primary endpoint. In the group of Bictegravir, weight change from 2.9 kilogram to 5.1 kilogram in the group of Bictegravir. But the other group, Dovato, is from 1.9 kilogram to 2.8 at week 96. The proportion of weight change more than 10% compared to baseline. The proportion was much higher in the group of Bictegravir, about 36 at weeks 96. And then we conduct logistic regression to identify the risk factor for those patients with weight change more than 10% at week 48 and 96. And we can find out the risk factors such as Bictegravir containing the regimen of Bictegravir and CD4 count less than 200 and BMI less than 24. But we know the baseline is different, and we have a lot of variable imbalance. So we conduct a propensity score IPTW to adjust the imbalance between these two groups. And we can find out after adjust by IPTW, the risk odds ratio, the odds ratio didn't increase from at week 48 to week 96. It becomes steady after week 48 for regimen of Bictegravir. But for those patients with CD4 count less than 200, the odds ratio increased steady from 2.8 to 3 times. And for those patients with BMI less than 24, and the odds ratio decreased slightly from 3.1 to 2.7. The other variables such as cholesterol, TG, triglyceride, HDL, and LDL, they also increase, and they increase between these two regimens, but the difference was not significant. And it's our conclusion. Bictegravir was comparable to, Dovato was comparable to Bictegravir in achieving virological separation during the follow-up from baseline to week 96. But we can find out physician preference was to prescribe Bictegravir for the individual with low CD4 count and higher viral load. So we adjust this imbalance by propensity score and IPTW. And Bictegravir was associated with great weight change compared to Dovato. But we can find out the risk factor of low CD4 count at the baseline steady increase from week 48 to week 96. Our strength is diverse of population. In Asia, the cohort is more than 1,000 HIV population. And our limitation, we have some missing data. And also, it's a retrospective study, so it's very difficult to dynamic weight change, measure the dynamic weight change across different regimens. And we try to adjust by IPTW, but also there was no recent data for some patients with meet the criteria with HIV IM more than 200 copies. And thank you as my acknowledgement for those patients in participate in this study, and also the hospital to join Dragon study group. Thank you.
Yeah.